Hi, this is Delegate Leslie Lopez of District 39, and you're listening to the Conduit Street Podcast, the best source of news and notes on Maryland politics and policy. The Conduit Street Podcast, the official podcast of the Maryland Association of Counties.
And welcome to the Conduit Street Podcast. Kevin Kinnally here with my colleague DePaul Nibber. We are going to get into a roundup of public health threats, several items in the news. And DePaul, you are the public health expert. Thank you so much for joining us today. We're going to get into a bunch of stuff, including lingering COVID issues. We'll talk about tick-borne illnesses. Monkeypox is a big issue out there, and a few other odds and ends. DePaul, thanks so much. How are you today?
I'm doing well. I'm thankfully not affected by any of the diseases that we will be talking about. It's a great time to be alive, and also an exceedingly frightening time as well.
That's a good way to put it. And let's jump right into it, DePaul. So COVID, we've talked a lot, obviously, about COVID. It is not going away. It's still out there. We still have lingering effects. We're seeing new cases every day. The positivity rate has jumped as to compared to where it was just a few months ago. So, DePaul, what's going on with COVID, particularly here in Maryland? What's the latest?
Yeah, so we're in the midst of an Omicron-related surge. So our testing positivity has seen a slight uptick recently. So within the last 24 hours, it's gone up by like 0.06%. So we're almost at 9% statewide in terms of testing positivity. Thankfully, that hasn't really translated into a massive amount of hospitalizations. In fact, what I'm looking at here on the state level is a drop of 9. So we're under 500 there. So we got plenty of beds should there be a terrible wave of COVID cases in the near future. But I think what we're seeing is the effects of folks getting vaccinated and the severity of the disease being lessened as a result. So we don't have to take up all those hospital beds. Sometimes folks have COVID and they don't even know it.
I think that's a great point about getting vaccinated. We've always said, the vaccine is not going to stop you from getting COVID, but what it would do and will do is keep you from being in the hospital. And I think you're exactly right. We're seeing that. And I will say, DePaul, I remember the days where the magic number for positivity was 5%, right? And you're saying we're around 9%. But I guess, again, things have changed because of vaccines. So that doesn't necessarily mean we have to start taking the measures that we used to have to take when people weren't vaccinated, when we didn't have the vaccine available.
That's correct. You won't see any sort of masking mandates on the local level across the state. It's kind of stark as compared to the early days of the pandemic. If we had seen numbers like this in the past, accepting the hospitalization number, of course, we would have almost assuredly had a couple of different measures in place. But, we've made such significant advances in terms of just the vaccine itself. I mean, just this week, we were hearing about a local Maryland company, Novavax, having its vaccine potentially coming to market. And then just today, I'm reading about Moderna, which has been on the market for a while, creating a booster shot that focuses in on Omicron. So these advances, I mean, they're going to keep us protected for the long term. I'm a little bit excited about that. And, one thing I should note about the Novavax vaccine is that it is protein based. So it's very similar to like the flu vaccines that folks have been getting for years. And the thought around this is that by virtue of it being more of a conventional type vaccine, more people will be willing to take it. If there's still people that are hesitant, I'm really hoping that this changes their mind. It's something that's based on the literature that they put out is over 90% effective. So on par with those mRNA vaccines that were put out by Moderna and Pfizer.
That's great. So of course, no shortage of availability for vaccines and boosters. And now we're also hearing we're going to start being able to get younger kids vaccinated, hopefully sooner rather than later. That's obviously something that's been on a lot of people's minds, especially when you talk about school. And obviously we're going into the summertime now, but we still have summer camps and things like that. And, I know people are anxious to get their kids vaccinated so that they don't have to worry, about their kid potentially coming down with a serious case of COVID. So that's also good news on that front. Are we still worried about the potential for another variant to pop up that, the vaccines don't necessarily cover? I know when they're making these vaccines, they're thinking about that and thinking about how they could quickly change the vaccines to account for a new strain of the virus. Is that something that I'm sure public health officials are still thinking about a lot?
Absolutely. And so I mentioned that Moderna has come out with its vaccine that's geared towards the Omicron variant. But, this process to get emergency use authorization, it's not automatic. It's not super quick. I mean, it is much quicker than, the traditional time it takes to bring a vaccine to market. But what you're going to see is, vaccines coming out and, perhaps being effective to an extent, but not providing that 100% coverage like the polio vaccine way back in the day. It's not going to wipe out the illness. I would liken it to the flu in that sense. There's going to be predictions about what protein spikes are going to show up within the newest variant of COVID, and then they're going to develop a vaccine around that. And then, maybe there will have been 2 mutations before it actually hits the market. But that doesn't mean that the vaccine you're taking isn't going to prevent, illness or, God forbid, death. So I think that's the kind of future we're looking at going forward.
Of course, we will continue to follow the latest public health guidance. We have amazing people working on this at the county level. And I want to pivot, DePaul, to something that's pretty terrifying that has obviously grabbed headlines in the past few weeks, and that's monkeypox. You wrote a great piece on the Conduit Street blog, which we will link in the show notes, just sort of walking through, what is monkeypox? What are we seeing in terms of guidance? And, what's the future here? So first of all, DePaul, let's talk about monkeypox. What is it? Are you concerned? And what are we hearing in terms of state and federal guidance?
Oh, it's a pox upon monkeys, like a curse. No, I'm just kidding. So monkeypox is a relative of smallpox. It's a virus, and it was originally found in the 70s in some West African nations, but it has since made its way all across the world. This most recent outbreak started in Europe, specifically within the United Kingdom. It has spread to numerous countries and now to numerous states within the United States. And its primary mode of transport is through respiratory droplets, much like COVID. So that's why you kind of hear about COVID and monkeypox being talked about in the same breath, no pun intended. Monkeypox can also be transmitted through direct contact. So you develop these sores people come into contact with, and that results in transmission. And then, there's indirect transmission that occurs by virtue of, someone having these sores, touching a blanket or bed sheet or something that other people come into intimate contact with, and then there's transmission through that. What's interesting about this recent iteration is that a lot of the cases that people have come down with were initially discovered in STI clinics. So people thought that they'd come in with some sort of sexually transmitted infection, and then it turned out to be something very, very different. And I think that speaks to the sort of intimate exposure element to the disease itself.
And in terms of symptoms and severity, is this something that can kill people?
It can if it's left untreated. It's not like the early days of COVID. There are vaccines available for it. And the last I read, there was plenty of supply for it. But there's also much less likelihood of it being transmitted from person to person. So I think it's certainly something that's on the radar of public health officials. I mean, the CDC raised its sort of threat level very recently, letting folks know that they should be taking precautions. Don't share towels with people and things along those lines. Keep your mask on as you would otherwise for COVID if you're going to be in settings where there's a bunch of people. But the disease itself, it presents as sores, rashes, fever, a lot of the things that you would associate with chickenpox. And I'm sure everyone has seen the sort of horrific images of the bumps that show up. That's obviously also a symptom that can present itself.
So monkeypox is out there. It's nothing new, but we've seen a spike, we've seen an outbreak, and that's made its way to the United States. And obviously, we have, again, our public health professionals issuing guidance. And so it seems like we can take some common sense precautions. And of course, like you said, there is a vaccine available. So I think a lot different than COVID. There are a lot of similarities here, but it seems like we're much better prepared to deal with this than we were at the onset of the COVID-19 pandemic.
That's right. I think that's probably why you're not hearing the sort of same kind of alarmist kind of news cycle around monkeypox like you heard with the early days of COVID. But that said, I mean, just like with any disease, there's the possibility of a variant if the disease stays out in the public sphere for long enough. So we should be vigilant, we should be cautious, and we should take this very seriously.
And DePaul, I want to pivot off of COVID and monkeypox to tick-borne diseases. Again, this is nothing new, but we are, that it's that time of year where we start to hear about, Lyme disease and other diseases, which you can get into. And I think it's really important for people to understand you don't have to be in the woods necessarily to come in contact with the tick. And there are different ticks that carry different types of diseases, right? And so I want to get into this. I know you have some personal experience here, but what's going on with tick-borne diseases? We've seen this also in the news, and we know our public health experts are trying to get the word out in terms of how to prevent this kind of stuff, and then what people can do if they do come into contact with ticks. What's going on, DePaul? Where are we right now? What are we seeing out there?
The conversation is so vast on this. I've had Lyme disease. My neighbor has had Lyme disease. We're borderline Lyme disease professionals between the two of us. But in terms of the disease itself, Lyme disease is one of many vector-borne diseases. And when I say vector, I mean an insect or other blood-sucking creature essentially is the mode of transmission. It has to make contact with you, and then it spreads the disease to you that way. There's actually 7 different kinds of transmission, and you hear about this as primarily being associated with ticks, but it could also be mosquitoes. It could be fleas. Anything that kind of ends up making close contact with you and sticking around for a minute is capable of transmitting these diseases. And so it's not just Lyme disease. There's Rocky Mountain spotted fever, ehrlichiosis, babesiosis. There's viruses that can be transmitted. There's the bacteria that creates Lyme disease that can be transmitted. There's actually protozoan parasites that can be transmitted. So it runs the gamut. The thing that folks need to be aware of is that when you go outside, bug repellent is kind of a necessity these days. It used to be that these tick-borne diseases were primarily located in New England or, out in mountain ranges out west. But, climate change has changed the game. The CDC has put out article after article talking about how disease spread has changed based on climate pattern. I mean, we have mosquitoes coming from South America, making their way into the United States and transmitting Zika.
Right.
And, from the north, we have these ticks that are migrating along with the deer into our communities and bringing, the tick-borne illnesses like Lyme.
This is not, just with ticks. You said it can be mosquitoes or anything that come into contact with you and lingers for a minute. Most people, when you think about ticks, you think of, okay, that's if I go into the woods, and I know if I go into the woods, I'm supposed to wear long pants and a long shirt and maybe put my socks over my pants. And then I'm supposed to check myself after to make sure that there aren't ticks on me. What else can people do to avoid, coming into contact with ticks and mosquitoes, of course, that can also carry these diseases? I mean, are there any best practices out there? And then what are you supposed to do if you find that you have a tick on you or you think you have a tick bite? What should you do right away in that case?
So if you find a tick on yourself, you should, first off, if you end up removing that tick, keep the tick. You should have that so that it can be tested to see if it carries any diseases. And that, if you are potentially infected, they can properly diagnose you and get you the proper treatment that you need. But,
so we're not supposed to burn ticks, right, Paul? I mean, I think some people, they think you should put a lighter to it. You should use tweezers, right? Let's just get that out there too.
No, I think those are old wives' tales.
Yeah.
What happens with anything like a tick or mosquito, when it makes contact and punctures your skin, it's releasing toxins that prevent your blood from clotting and things like that. So like the thought was like you burn the tick off and like it will prevent it from from keeping your blood from constantly flowing out, but that's not actually the deal. What you want to make sure, though, is that the tick does not stay on you for a prolonged period of time. I've heard various accounts of this, but for Lyme, it was like if a tick's been on you for like 24 hours, then, transmission is highly likely if the tick was a carrier of Lyme. You just want to make sure that you get the tick off you as quickly as possible. But, again, like wearing clothing to protect yourself, being aware of like the presence of ticks around you. There's various resources around that. There used to be some heat maps available of like where like tick cases are concentrated. I have a feeling that those are just woefully outdated at this point. They used to like come down to Pennsylvania and then stop kind of at the Mason-Dixon line. That's no longer the case.
I should mention too, DePaul, it's not just, you need to check yourself. If you have pets who are out in a field or in the woods, you need to check them as well, because a tick can jump onto your pet and then the pet comes inside and all of a sudden the tick can jump onto you, right? So it's not, you need to check your pets as well.
Absolutely. I mean, they have preventatives for animals. There's a Lyme disease preventative that you can get. I mean, make sure that all of your animals are up to date on everything they need to be outside. I can't emphasize that enough, because, Lyme disease is terrible. Again, I went through it myself, but like an animal can't talk to you and explain symptoms, they're just going to be constantly under the weather or feeling one way or another. And, you're just going to end up doling out for test after test. Not unlike my experience, actually.
Right. And so I guess the bottom line here is, you're not going to be able to avoid ticks, every single day. But the key seems to be make sure that if you do come into contact with a tick, you get it off fairly quickly. Especially, you don't want to wait more than 24 hours, because if that tick is carrying Lyme or another disease, it's fairly likely, if they've been on for that long, that it's going to transmit that disease to you or to your animal, like we said. So you got to check be vigilant and make sure that we're taking the precautions. And DePaul, I know one more thing we should talk about here. I think it's timely as we wrap up. Acute communicable disease prevention. What is that, and how does it function in state and local health departments? Because I know that's something that's on a lot of folks' minds as well.
Yeah, actually, it's a core function of both the state health department and local health department. And, it's been enshrined in law for a minute. Our local health departments get money from the state to carry out this function. And thank God we have a change in our funding formula going forward that's going to, put more money towards this beginning in, I think, 2025. But in any case, any boost that we can give to these programs is great. I used to work for the Baltimore City Health Department, and I regularly spoke to our acute communicable disease staff because they dealt with so much. I mean, measles, when there was an outbreak in the Baltimore region, those cases got reported to us, and then we had to do case follow-up and, make sure that there were mitigation measures in place. And, it was just a really intense process. And it actually ended up being the sort of foundation for a lot of COVID response across the state. So acute communicable disease, our hospitals and providers are required to report these cases to local health departments or to the state. And then there's case management that occurs beyond that point. Sometimes the feds get involved. And the list of diseases are actually written in our local regulations. So that actually does include things like Lyme, measles, and a couple of other like major diseases. And what was interesting to me was that, it's not a job that ends with the workday. When there was like a measles outbreak, for example, we would have someone assigned with a cell phone to take calls from healthcare providers to log cases and then get in touch with, state staff or local staff that could respond immediately. I was that person once upon a time. We tried our best to make sure that everyone across the state is safe. And, it's such a critical function that I don't think gets nearly enough attention. But that when we talk about contact tracing, like these guys have been doing it for a number of different diseases for decades at this point. So, kudos to the people out there that are working on this. And I hope the public is just aware of how close we all are to disaster, but for their interventions.
One of the things I think COVID certainly highlighted the role of our local health departments. But like you said, I mean, this is something that they've been doing for a long time. And I think people hopefully understand how critical their work is. And it's not like we just come in and say, hey, we have COVID, so now everybody has to get to work. This is something that's going on every single day. There are all kinds of things that they are working on every day to make sure people stay healthy, to make sure people understand the simple precautions they can take, especially for the stuff that we talked about today, monkeypox, tick-borne diseases, stuff like that. It's super important, and it's work that's going on every single day. And you're right, kudos to them. DePaul, we'll wrap up. Any closing thoughts from you before we wrap this episode?
Yeah, just kind of going back to the tick-borne, mosquito-borne illnesses. So one thing I want folks to be aware of is avoid still water. That's where mosquitoes breed. So you're going to find like that, the larvae gestate there, and then, you're going to have a bunch of mosquitoes within that area. If you have standing water on your property, I highly recommend that you tend to it or avoid it if you can't. With respect to ticks, if you know an area that is heavily trafficked by, wildlife, that's an area that is more likely to have ticks. I mean, it's not just going to travel with deer, right? It's going to travel with other animals as well. So if you see foxes, if you see deer, If you see raccoons flying around in a park nearby, that's when you should be a little bit on high alert. Just wanted to make sure that folks are aware.
DePaul, this is great. Thank you so much. I think we got a lot of useful information out there today. Nothing I think to be, for folks to be alarmed about, but there are simple precautions we can all take to make sure that we nip stuff like monkeypox in the bud so it can't mutate. And then, of course, that we're going to have to deal with ticks forever. We're probably going to have to deal with COVID forever. So we all just need to be careful and make sure we're taking the right kind of precautions to nip this stuff and make sure that it doesn't continue to spread. Thank you so much for joining us today, DePaul.
Yeah, it was my pleasure. Thank you.
All right, we'll go ahead and leave it there. As always, if you enjoyed the podcast, please go ahead and subscribe. That way, all of these episodes will be sent directly to the device of your choice. You can also follow along on social media, Facebook, Twitter, and then, of course, the Conduit Street blog. But for DePaul Nibber, this is Kevin Kinnally signing off, and we will talk to you soon.